Today we are here again with another new topic of physiotherapy on the Physio TV. Today we have an eminent speaker, Dr. Pallavi S. Varian. She is a physiotherapist, an academician, and also a PhD scholar. She is into academics since past 6 to 8 years, and she's been practicing her physiotherapy expertise in community-based rehabilitation. She herself has served as being the assistant professor at a reputed colleges and also been guiding and teaching the undergraduates, postgraduates, and also mentoring them. Her research interests include community reintegration after spinal cord injuries, rehabilitation outcomes, patient education, and use of digital tools in healthcare education. There are many published articles on her name. She has published many of the articles which are on the Scopus and web of the Science Index journal. She also is been invited as the keynote speaker, reviewer, and also an active participant in many of the health initiatives driven by the strong commitment to inclusive, patient-centered rehabilitation and social integration. So here today we have on Physio TV with the association of IITWC Pune branch. I, Dr. Varsha Kulkarni, along with my teammates Dr. Ankita, Dr. Suroshri, and Dr. Saili, would like to invite Dr. Pallavi on the talk show. Welcome so much, and also we are highly immense to hear you, Dr. Pallavi. The platform is yours. Thank you.
A very good evening to all of you. Thank you to Sancheti Institute of Physiotherapy for giving me this opportunity, and thank you for the introduction. Starting with the topic that is from rehabilitation to real life, assessing community reintegration in patients with spinal cord injury. Basically, first, we need to identify that what community reintegration is, right? That the people who are suffering from spinal cord injury, they might have some kind of permanent damage in their life if the spinal cord injury is up to some extent. And after going through a long rehabilitation at any of the rehab centers, or whether it is at a home based setup or anything, the community reintegration is little bit difficult for them, right? They do not have the same aspect as before the injury. So it is very much important that we need to see that how the community reintegration goes. And even if we focus on the ICF framework, that also specifies in the components that community reintegration is important, which also involves the social participation, and it also involves functional capabilities. You might have also seen something like as barriers or facilitators in personal factors section, right? So community reintegration will be a very much integral part after spinal cord injury. And specifically assessing this community reintegration is one of the major roles of a physiotherapist, because a person is spending much of his or her time of the day with a physiotherapist during the rehabilitation, right? So when a spinal cord injury is occurring, it is affecting patients mobility, it is affecting patients independence, and that is eventually changing the whole day to day dynamics of that person. It is also involving the cognitive aspect, which we usually term it as mental health or understand as mental health, because that will eventually affect their social connections also. So all these things are leading us to assess the community reintegration, and just asking few questions to the patient is not important. As always, it is stated that you should have a proper documentation. So today we are going to discuss few of the outcome measures that are reliable and valid. In this webinar, I would be discussing the outcome measures in English language only, and all those outcome measures are already available on internet in their PDF format, but few of them have also been translated into regional languages like Hindi and Gujarati. ICF, which I already mentioned in the starting of the slides, that it also focuses on the community reintegration aspects. This is a basic image of the ICF that includes health condition in the center, and then we have body function and structure that focuses on that what a person is having structural impairment. For example, if it is a person with spinal cord injury, then what level of injury they have, or which level of vertebrae they have got fractured or injured. Then comes there are participation factors, and then we have personal factors, activities, and environmental factors. I'll be focusing on the other four aspects mentioned in this ICF. We are not targeting today the body structure and function aspect of the ICF. We are going to assess the all other four points which are mentioned in this image. So there are many outcome measures that are available freely for the research purpose or even for the clinical implication purpose. Today we are going to discuss few of them. The first one is titled as Reintegration to Normal Living Index. Now what it is, as the title itself says, that it is related to reintegrating into normal life. So it is a self-reported questionnaire, and it is going to assess the mobility and self-care and relationship of the person who is having SCI. The second one is CRAG handicap assessment and reporting technique. This is also termed as chart questionnaire, and it has 6 domains, and it is focusing on the physical independence and the social integration. The third one, which we will discuss in detail, is community integration questionnaire. This will be specifically focusing the participation of the person in home, in social activities, in any specific kind of productive activities. So overall, the whole community involvement will be assessed by this questionnaire. Then we have the fourth one, that is CRAG Hospital Inventory of Environmental Factors. Now, this scale is focusing on assessing the environmental factors that are going to actually limit the community participation. In this scale, once we discuss in further minutes, it has two forms. One is a long questionnaire, and the second one is short form. I'll be presenting both to you. And the fifth one, which we have, is WHODAS, that is WHO Disability Assessment Schedule. This is again going to assess the disability experience of a person, but that experience into the community. Like once they have started living into the community, now what is the environmental aspect, which is any of the barrier which they are facing, or any of the social barrier which is being faced by them. Two important outcome measures, if we want to specifically highlight them under the heading, that will be spinal cord independence, right? Because community reintegration also has one of the important part, that is how much a person is independent. So in that we have two outcome measures. One is functional independence, that is SCIM, and the second one is objective participation assessment, that is part O. Now, if we talk about SCIM, that is termed as spinal cord independence measurement, and it is going to give you the basic idea about a person's activities of daily living, whether it is feeding or bathing or anything, and if they want any kind of assistance while bathing or toileting, or if they want any kind of assistance during feeding. And when you talk about the second outcome measure mentioned on the slide, that is part O, that is again going to check the participation in social and other activities, and seeing how much community engagement is a person having at different levels of social participation. If you want to check both the aspects together, then even both the scales, that is SCIM and part O, can be assessed. The all the things which I have mentioned, that could be a part of quantitative research. Once I'll show you all the scales, we might get the score in any of the numerical value, and that is why that will fall under quantitative. But when we want to have another aspect of the research, or you want to convert patients' experiences, live experiences, into any of the documentation, then qualitative research comes into picture. And when you talk about qualitative research, the two most common methods of collecting the data or knowing what the person is experiencing are focused group discussions and in-depth semi-structured interviews. In focused group discussions, what basically we do is we contact many of the patients, and there is a group of 5 to 6 people who are suffering from same kind of disease or condition, and then you will ask them a set of questions, and then the analysis parts comes into picture. But here you are, what you are getting from the patient is the words, right? The patient are going to tell their experiences in their own words, and then you are going to learn, and you are going to analyze that what actually the community reintegration picture is in their life. Second is in-depth semi-structured interviews. Here it would be a face-to-face interview or a call interview or a online interview using any of the platforms, wherein a pre designed interview guide is there, and you are going to ask them some questions, and there are set of number of patients who will be approached, and you ask them, and then again you are getting the experiences of patients in their own words, and you will be then analyzing it, and then you again frame that, okay, this is the uh, facilitator, or this was the barrier which the patient is right now facing. So whatever the outcome measures which I have mentioned before this slide, those already contain the predefined questions related to activity, related to social participation, related to environment. But when it comes into this slide, qualitative, here you are asking something to the patient. And consider one example is that you may ask that how a social relationship is being maintained in your family after the injury, right? So what we right now want to ask is कि अगर patient को मैरिज में जाना है, उनको किसी फैमिली मेंबर ने कहीं से इनवाइट किया है, एंड लाइकवाइज, सो हाउ इज दैट सोशल पार्टिसिपेशन बीइंग मेंटेन्ड? So maybe there would be many varied answers. Somebody may answer you that my family members help me, they assist me, and then we go into that. Somebody may answer that I have stopped going into such social gatherings or social functions, and the other members of the family are already dealing with that, or they are maintaining it, right? So likewise, this is one example of the question and the answer which you might get. There could be many other questions related to the specific goal which you have, and here this example was given as our goal is community reintegration. On what basis you are going to decide whether which outcome measure needs to be used? So now this will depend on what type of research you want to do and what clinical implication you want to have from your outcome measure. So if it is specifically related to any of the environmental barriers, then we have a different scale. If it is specifically related to any of the social participation component, then we have a different outcome measure, right? So what is your patient's goal, what is your goal, what is your documentation getting into picture, so we will focus on that, right? So one will be this will be the selection criteria. There will be a combination of tools also that can be used, that you want to assess both the things. You want to assess environmental barriers also, you want to assess the social aspect also, then you can combine one or two tool, and then also you can assess the community reintegration. Standardization importance, as I have mentioned, whatever I am going to discuss in further minutes, all those tools are reliable and valid, and already reliability and validity testing has been done of these tools. But if you are finding anything else other than these tools, or if you are going to use any of the tool in the regional languages, again you need to see what specific reliability and validity assessment has been done. You need to cross check it. And what if it should not happen that if a person, if any of the outcome measure is being used and it is not related to the Indian context, right? Right now we are dealing with the Indian population. So in that there comes into a picture that is word that is cross cultural adaptation. Okay, but that we might discuss some day later. Today we will discuss all the English versions of these outcome measures. Now let me take you to the outcome measure. First outcome measure which we are discussing right now, that is your reintegration to normal living index. So basically in this scale we will be having 11 questions. Okay, and these 11 questions will be accompanied by a visual analog scale. What you do is you show the patient that visual analog scale, and you ask the you give that outcome measure to the patient, and then patient is going to rate
Hello.
from 1 to
Sorry to interrupt you, ma'am. Ma'am, I think the slideshow is not seen. What I can see is Canva's full screen, ma'am. Can you please put it on slideshow mode?
yes ma'am, yes ma'am, is it visible?
Ma'am, what I can see is reintegration to normal
Yes,
living
yes,
index. That.
yes.
Okay, okay. It's visible.
So the outcome measure which we are going to discuss now, that is reintegration to normal living index. Here what a person is supposed to do is you are going to give them a visual analog scale. Okay, and all of these 11 items present in this scale are being scored through the visual analog scale, wherein 1 will be a minimal reintegration and 10 is complete reintegration. Now before checking or before learning any of the outcome measures, first you need to see the purpose, that what the purpose that specific outcome measure is serving. So as I mentioned, this is going to reflect on the reintegration aspect. Second thing which we need to see is how that outcome measure needs to be scored. So in over here, as we have 11 questions, the total score will be, all the items will be summed up, and then there will be the total score. But after the total score, what we need to do is we need to find out the adjusted score. Now, how do you find the adjusted score? Once you get the total score from all those 11 items, as mentioned here on the screen, the total score is divided by 110 into 100. Okay. And out of that, you will get the adjusted score. Now, this minimum adjusted score will be 0 and maximum adjusted score is 100. So, higher the score, higher the community reintegration you might get. Now, let me take you to the 11 questions of this outcome measure. The first question which we have is that I move around my living quarters as I feel is necessary. Here again a visual analog scale is kept, and the person will be marking from 0 to 10, and then they will here put their score that okay, this is the question, I move around my living quarters as I feel is necessary. Here it is clearly mentioned that whatever assistive device or whatever walking device is being used by them, that is okay, but a score should be mentioned. Second question, I move around my community as I feel is necessary. Now, the first question was, it was around the living quarters which a person is living in, and the second one is related to around my community. Third one, I am able to take trips out of town as I feel are necessary. Whenever the person wants to move out of town in or any of the trips they want to do, they are able to do or not. Again, this is these all are the sentences. What? Right? The person, this is a self-reported questionnaire, as I had mentioned earlier in my slides also, that it is a self-reported questionnaire. So self-reported means के आपको ये चीज पेशेंट को दे देनी है एंड पेशेंट खुद से ये क्वेश्चनर को फिल करने वाले हैं. दैट इज व्हाई द क्वेश्चंस आर स्टार्टिंग विथ आई मूव अराउंड माय लिविंग क्वार्टर्स एज आई फील is necessary. I move around my community, or I am able to take trips out of town. Fourth one is I am comfortable with how my self care needs are met. So, whatever the self care needs of a person with SCI might have, whether it is dressing, feeding, toileting, bathing, whatever, all those self care needs, in whether a person is using adaptive equipment or if it is under supervision, or if even if assistance is being used, but a person is comfortable or not, they are supposed to rate it from 0 to 10. Coming to the fifth question, just a second. I spend most of my days occupied in a work activity that is necessary or important to me. Now, a person with SCI might spend the whole day in specific kind of activity. They might not spend, they might be just lying on a bed. They might be doing any of the volunteering activity. They might be going to school. They might be employed. So they need to grade that aspect here into the fifth point. Coming to sixth, I am able to participate in recreational activities. Now, what do you understand by recreational activities? Here it is clearly again mentioned in the bracket, whatever the hobbies a person has, a craft activity, any of the sports in which they would like to participate, whether it is reading, television, painting, likewise. Okay. Again, as I want to, right? If the adaptive equipment is used, then also it is not a trouble. Seventh one, I participate in social activities with family, friends, and or business acquaintances as is necessary or desirable to me. I have given you the example of this area in the qualitative research also, right? That this is one of the area where community reintegration is important. So here again, the person will grade from 0 to 10, that whether they are participating in any of the social activities or not. Coming to 8th, I assume a role in my family which meets my needs and those of other family members. Okay. Now, here the family members, what do you mean by family members? Those are the people whom with you are living. Okay, or even for the people whom you are not meeting every day but on a regular basis, maybe they are not living with you, right? That also might fall under a family, right? So here this will be focusing on how much a person is getting engaged into the family. Ninth one, in general, I am comfortable with my personal relationships. Whatever the personal relationships a person has, this might vary from person to person. If it is 60 or 70 years of person, then the personal relationships may vary. If a person is young, married, unmarried, all that areas will be focused here. 10th one, in general, I am comfortable with myself when I am in the company of others. Now, this 10th is focusing on the self awareness of the patient, the self confidence of the patient. Again, the person has to score from 0 to 10. And the last one is I feel that I can deal with life events as they happen. Now, here you can see this is the total score, a row is given, and then you have a adjusted score. So, as I mentioned here, that a person is supposed to grade all those 11 items from 0 to 10, wherein 1 is minimal integration and 10 is complete reintegration, and that will you are going to get the total score. Then out of that total score you are supposed to find out the adjusted score of the person who is suffering from SCI, right? So this is one outcome measure, that is reintegration to normal living index. Now let me jump to the another outcome measure, that is chart. Now here, this is a scale that is in different components, and now here you are going to ask the questions to the patient. Okay. First question is, or first area is related to what assistance is being needed by the person who is suffering from SCI. We already know that people with disabilities, they often need assistance. Now here there will be a division between physical disabilities and again for the cognitive problems as well. This section from one which we are right now will be discussing, that is going to focus on all the physical assistance required by the person. That might include eating, grooming, bathing, dressing, any of the another things, like for example management of a ventilator or other equipment or transferring activity. Here, the first question states that how many hours in a typical 24-hour day do you have someone with you to provide physical assistance for personal care activities such as eating, bathing, dressing, toileting, and mobility? So, you are going to ask that person that during those 24 hours, how many hours the anybody is having with the support, right? Why they anybody is continuously with them for the assistance or for the support. Now, for which activities? All the personal care activities which a person needs, that is eating, bathing, dressing, and toileting. Now, here a very important thing which needs to be focused. There are two sections. One is the hours wherein that is a paid assistance. They might have kept a caretaker or anything. They might have appointed a caretaker. So that will fall under the paid assistance. And unpaid assistance wherein the family members or any of friends or anybody else is helping, then that will fall under the unpaid assistance. Coming to the second question, just a second. Not including any regular care as reported above, how many hours in a typical month do you occasionally have assistance with such things as grocery shopping, laundry, housekeeping, or infrequent medical needs because of the disability? Now, whatever the above activities were mentioned that were of the personal care activities, other than that, grocery shopping, laundry, housekeeping, is a person in a need of assistance? If yes, then how many hours per month? Third one, who takes responsibility for instructing and directing your attendants and or caregivers? So whether if they have appointed a caregiver or they have appointed an attendant, then what who is the responsible person? Whether the person himself or herself, if anybody else is responsible, or if it is not applicable, that person is not using the caregivers or the attendant care. So these three questions will be focusing on the physical aspect. Now the another questions are going to focus on the cognitive problems. The fourth one which we have, that is how much time is someone with you in your home to assist you with activities that requires remembering, decision making, or judgment. Okay. Now here they are not asking about any of the specific hours or something like that. They have just given few points. So one is someone else is always with me to observe or supervise. Someone else is always around, but they only check on me now and then. And the third one, sometimes I am left alone for an hour or two. Sometimes I am left alone for most of the day. I have been left alone all day and all night, but someone checks in on me, and I am left alone without anyone checking on me. So the if you look at all the 6 points, it is starting from nobody oh, sorry, it is the last one is, if we go from the reverse order, the last one is nobody is checking, and the first one is that there is a continuous check on the person. And in the middle sections, we have the intensity is being varied, right? The fifth one, how much of the time is someone with you to help you with remembering, decision making, or judgment when you go away from home, right? This the fourth question was limited only to the homebound environment. Now, if the person is going away from home, then what is the time that someone is going to help with them. So the first one is I am restricted from living even with someone else. Someone is always with me to help with remembering, decision making, or judgment when I go anywhere. I go to places on my own as long as they are familiar, and I do not need help going anywhere. So this is again focusing the participation aspect of the ICF domain, right? In as I stated that community reintegration is also focusing on the social participation. The sixth one we have, how often do you have difficulty communicating with other people? So I always have a difficulty, I sometimes have difficulty, or I almost never have difficulty. So this is focusing on the communication aspect. Seventh, how often do you have difficulty remembering important things that you must do? Now, this is about, as we are mentioning, the focus on cognitive aspects. Memory is one of the important parts which needs to be focused on. So, this is the question related to that, that you are going to ask that how often do you have difficulty remembering the important things? Here, the three sections will be repeated as in the question 6. Eighth one, how much of your money do you control? Now, this is about the financial uh, independence of the person after SCI. None. Someone makes all money decisions for me. A small amount of spending money is given to me periodically. Most of my money, but someone does help me make major decisions. I make all my money decisions. Or if married, in joint participation with my partner. Right. So these were the questions that are focusing on the cognitive aspect, that focused on the participation area, on the memory area, and even we had one question that is related to the financial independency. Now I'll move further. Now the ninth to 13th question focuses on the day activities which usually a person might have during the daytime. The first one is, on a typical day, how many hours are you out of bed? There will be many patients who are suffering from SCI that they will be spending their whole day and night only by lying on the bed. That might be one of the reason, could be that their condition. Second could be they might not have gone under a proper rehabilitation. Third could be their psychological status also, right? 10th question, in a typical week, how many days do you get out of your house and go somewhere? You are going to supposed to ask them. Somebody may ask you all, somebody may tell you all the 7 days, somebody may tell you 3 days, or likewise. In the last year, how many nights have you spent away from your home, excluding the hospitalization days should be excluded here, and whether the person has gone somewhere for a trip, at least in a year. A person, even a person who is not having SCI, they might also are in a state wherein they require some time away from the home, in a different atmosphere, in a different environment. So here also that should be taken into account. 12th one, can you enter and exit your home without any assistance from someone? Here it is very important, but it is only asked in component, that whether it is yes or no. A detailed answer is not required, that if anybody is answering no, then why no. That area then we are supposed to focus when you are doing a qualitative interview, right? You are going to ask that why reason can be identified in that area. 13th, in your home, do you have independent access to your sleeping area, whether it is kitchen, then bathroom, telephone, TV? These last two questions are also targeting the architectural aspect of the community reintegration, right? In the above aspects, we saw the physical aspect. Then the second part was focusing on the cognitive aspect. Now this third one is focusing also on the architectural aspect. Now coming to the transportation area. 14th, can you use your transportation independently? Again, the answer should be in yes or no. Does your transportation allows you to get to all the places you would like to go? Yes or no. Does your transportation let you get out whenever you want? There will be many modifications that might have been made by the patient if they are living with SCI since many years, and if they are motivated enough and they want to leave their life along with the damage which is, and they are finding any of the solutions, then I have seen many of those people who have made modifications at their home. They have made modifications in their transportation, but then there will be few of the barriers which they might face related to the environment, related to the architecture that is spread into their surroundings. Jumping to the 16th question, does your transportation let you get out whenever you want? I'm sorry, I discussed this. 17th, can you use your transportation with little or no advance notice? Okay. Sometimes a person wants to use the transportation, but any of they might need assistance. They might need to tell anybody that, okay, now I want to use car, or I want to use a bike. But here again, that aspect is also covered. You are going to ask that without even advance notice, will you be able to use or not? Coming to the 18th question, that is, how do you spend your time? 24 hours, how those 24 hours being spent? How many hours per week do you spend working in a job for which you get paid? Right? If a person has undergone vocational rehabilitation and they have started earning, they have started doing job, then you are going to ask this question, and you are also mentioning the occupation. How many hours per week do you spend in school working towards a degree or in an accredited technical training program? This question will reflect on the people who are right now studying, who are going to school or colleges, or even if they are specifically taking any of the training programs. 20th one, how many hours per week do you spend in active homemaking, including parenting, housekeeping, or food preparation? Now, if you uh, see this question, and if you correlate this question to some parts of the India, you might feel that you might get an answer from a male, that we were not included in housekeeping or food preparation earlier also, right? So here area comes, that is cross cultural adaptation. Okay. I am not telling that all of the, neither I am talking here about any of the gender bias, but you might get such answers from the community that we were not involved in housekeeping or food preparation. And even any of the females might also answer you the same, that I was not involved in the food preparation earlier also, that I had a maid or I had a cook that was that was clearly dealing with all these things. So right now also it is being dealt with it. So here that aspect should be noted. How many hours per week do you spend in home maintenance activities such as gardening, house repairs, or home improvement? Again, this is the question that will be little bit um, different when you talk about the Indian context. How many hours per week do you spend in ongoing voluntary work for an organization? You can ask this. Then, how many hours per week do you spend in recreational activities such as sports, exercise, playing cards? In the previous scale, also, that was RNL, we had this question related to recreational activities. Then, how many hours per week do you spend in other self improvement activities, whether it is hobbies or leisure reading? But here, any of the specific hobbies that are not productive, in terms of that are not self improving, that will not be included. With whom do you spend time? First question will be if the person is living alone or not. If the person is living alone, then we are supposed to directly jump to the question number 26. And if a person is not living alone, then the question comes is, do you live with a spouse or significant other? How many children do you live with? How many relatives do you live with? How many roommates do you live with? And how many attendants do you live with? Okay. 26th, if You don't live with a spouse or a significant other. Are you involved in any of the romantic relationships, right? 27th, how many relatives do you visit? The ones who are not present in the household, but other than them, how many is the person visiting through, or how many the person is contacting through a phone? 28, how many business or organizational associates do you visit, phone or write to at least once a month? So here also you are going to ask about the numbers. 29th, how many friends do you visit, phone or write at least once a month? And 30, with how many strangers have you initiated a conversation in the last month? So here all the aspects of the integration are being covered. The last aspect, the what financial resources a person might have, approximately what was the combined annual income in the last year of all the family members. Here you are going to ask about the combined income. You might have heard about a scale that is known as Kuppuswamy scale, that states you about the socioeconomic status of the person, and in that also we ask one question, that what is the annual income, but over there we ask about the head of the family. Here we are going to ask all the resources of the family, whatever it is, whether it is investment, whether it is any of the benefits which they are getting from any of the other disability schemes, likewise that will be included here. And one important question, that approximately how much did you pay last year for medical care expenses, and once paid, if it was not reimbursed through any of the insurance or any of the government schemes or anything, then that should also be included. So these are the 32 questions which you will be asking to the person who is suffering from spinal cord injury, and this is again targeting on almost all the aspects of community reintegration. So we have discussed two scales till now. One is RNL and second is chart. Now let me jump to the third one. Now this scale is termed as community integration questionnaire. Here the answer section includes, for the first five, has three components: yourself alone, yourself and someone else, and someone else, and the scoring will be from 2, 1 and 0. The first question is, who usually does shopping for groceries or other necessities in your household? Second one, who usually prepares meals in your household? Third, in your home, who usually does normal everyday housework? Fourth, who usually cares for the children in your home? And fifth, who usually plans social arrangements such as get togethers with family and friends? This whole aspect is focusing on the home integration. In this community integration questionnaire, it has been divided into parts. So first one is the home integration. So this home integration, you are going to write on this over here the score from 0, 1, 2, and then a person, you are supposed to write the total over here. Coming to social integration. Sixth one, who usually looks after your personal finances, whether it is banking or paying bills. Okay. Now, again, the scoring is on the basis of yourself alone, yourself and someone else, or someone else. The next three questions here, we are going to ask about how many times a month a person is specifically participating in all these activities. The scoring will be, again, if the person says that I am participating, I'm going for shopping for more than 5 times a month, then you score them a 2. If the answer is between 1 to 2, then the score comes 1. If a person says that I have stopped going shopping and I do not go, my some of my family members does that, then you score 0. So the activities which you need to ask them are shopping, any of the leisure activities, or visiting friends or relatives. Now here, if a person tells that, okay, they are participating in any of the leisure activities, then are they participating in leisure activities alone or with somebody else? So here again, you will have a scoring from 0, 1, 1, 2, and 2. If it is person says that mostly alone, you score 0. Mostly with friends who have head injuries, or mostly with family members, okay, then again here it will have 1. Mostly with friends who do not have head injuries. Here, it is very clearly mentioned regarding the head injuries, because uh, community integration questionnaire is also used in traumatic brain injury patients also. And there is not always a case that if a person is suffering from SCI, then it is pure SCI only. Okay. 11th, do you have a best friend with whom you confide? If it is yes, then you score 2, and if it is no, then it is a 0. And then what you do is you do the total of the scoring, and that will be giving you a social integration total score. Then we have integration with productive activities. Here, the question is, how often do you travel outside the home? Here, the grading will be almost every day, almost every week, or never. 2, 1, and 0. Then please, here we are going to ask regarding this question, and we are going to score it like that way. For example, just a minute. I'll directly go to the next page. If we are talking about, if you ask a person that I am not, uh, if you ask a person that where do they work, right, then person says that I am not working and I'm not looking for work, then you are going to give them a score of 0. Item 14, whether you are going to school or what you are studying, person says I'm not going to school, the answer goes 0. The score goes 0. Item 15, you have asked what volunteer activities do you participate or how much, then they again the score goes that I am not at all participating in any of the volunteering activities. And here also it will be, the score will be 0. Okay. Now again the person says you are asking the same question, and they say that I'm not working, not at all, not looking for work, they might get 1. Not going to school, again 1. And the person tells that I volunteer for 1 to 4 times, then you give them a score of 1. Item 13, actively looking for work, a person states, then you score 2. And item 15, volunteers 5 or more times per month, then you give them a score of 2. A person states it is he or she is working part time, the score will be 3. Or even attends, this will be applicable varying from person to person. If a person is going to school, then you score them accordingly. If a person is working, then you score them accordingly. Okay. Now, if they are working full time or attending full time school, then a score of 4 will be given. If a person tells that they are also working full time and they are involved in any of the activities or training programs, then they might get a score of 5. And even vice versa, a person tells that I am working part time and then I am also attending any school or attending any training program, then also there will be a scorecard of 5. If a person is retired due to a age, then 15, the item 15 which we have seen, that will be variable. I'll jump to again 13, 14, 15th item for giving you the clarity. This is during the work situation, school or training program situation, and the 15th one is volunteering activities. All the scores will be summed up: the home integration score, the social integration score, and the productivity score. Okay, and then you will get the total community integration score. So till now I have discussed three outcome measures: RNL, chart, and CIQ. Now I'll jump to the next one. Now this is Craig Hospital Inventory of Environmental Factors. I'll directly jump to the scale. It has two versions. One is long version and another one is short version. Okay. Now in this questionnaire, you are going to see that the marking is on the basis of daily, weekly, monthly, less than monthly, or never. Okay. And even there is a section of not applicable, and even there is a section of big problem or small problem. Why not applicable section is given? That because in this there are few questions that are related to school or work, and if that questions are not applicable to the person, then we can click not applicable. First question is, in the past 12 months, how often has the availability of transportation been a problem to you? Then the person has to tick whether it is daily, weekly, monthly, less than monthly, or never. Okay. And if it is a problem, if it is occurring, then how big is that problem, whether it is a little problem or big problem. Then in the past 12 months, how often has the design and layout of your home made it difficult to do what you want or need to do? Here it is talking about the architectural aspect. So the person, again, as you are seeing, all the questions are asking are in the form of a question that a person is sitting in front. So you can give this questionnaire to the person and they can fill by themselves also if there is no language barrier, right? So when this problem occurs, whether it is a big problem or little problem. In the past 12 months, how often has the design and layout of buildings and places you use at school or work made it difficult to do what you want or need to do? So this is talking about the school or the work environment. Fourth, in the past 12 months, how often has the design and layout of buildings and places you use in your community made it difficult to do what you want or need to do? The second question was related to home. Third question was related to the school or the workplace. Then fourth one is related to the community. In the past 12 months, how often has the natural environment, that might include the temperature or climate, made it difficult to do what you want or need to do? In all the questions you will find that if the person is ticking any of the five sections, whether it is daily, weekly, monthly, less than monthly, or never, then the person also has to tick whether it is a little problem or if it is a big problem. The sixth question, in the past 12 months, how often have other aspects of your surroundings, lighting, noise, crowds, etc., made it difficult to do what you want or need to do? So, this is about the environmental aspect. Fifth question was also that. Sixth is also focusing on that. Seventh one, in the past 12 months, how often has the information you wanted or needed not been available in a format you can use or understand? So here it is about the informations, whether information could be anything, it could be related to anything. And if that person wanted, and here please mark it is written not been available. So this should be focused on when the person is filling this questionnaire. In the past 12 months, how often has the availability of the education and training you needed been a problem for you? Consider if there is a person who wants to get educated even after suffering from SCI, but because of one or the other reason they are not getting it, then again it is needs to be marked. Ninth, how often has the availability of healthcare services and medical care been a problem for you? In all the three outcome measures which I have discussed till now, this aspect was not covered. Here it is written, yes, we had seen regarding the financial burden, that how much financial expense was done by the person, but what about the availability? If a person wants to immediately get some kind of care, was that available or not? 10th one, how often has the lack of personal equipment or specially adapted devices been a problem for you? Consider patient might have required a wheelchair, a eyeglass, a hearing aid, or even a crutch or a auxiliary crutch or any of the assistive or walking devices, then whether it was a problem or not. 11th, how often has the lack of computer technology been a problem for you? If there is a lack of computer technology, then a person might tick the section, and if it is never a problem, then they might tick that. 12th, how often did you need someone else help in your home and could not get it easily? Now here the role of the family is coming into picture, that if help was needed and a person, whether the family person had helped or not. 13th, how often did you need someone else help at school or work and could not get it easily? Now, if a person tells that I'm not going to work or I'm not going to school, then they might tick not applicable. You can see in most of the questions, you are having the section, I'm so sorry, over here, not applicable. Okay. Wherein whatever the questions wherein the school and work area will be included, there will be not applicable circle given. 14th, how often did you need someone else help in your community and could not get it easily? First was to the home, second school or work, third is community. 15th, how often have other people's attitudes towards you been a problem at home? Then the subsequent question will be other people's attitudes, a problem at school or work. And the another question will be other people's attitude towards you being a problem in the community, right? So the questions, but they will be focusing, all these questions are focusing one at a home environment level, second at a school or work environment, and third at a community. 18th one, how often has a lack of support and encouragement from others in your home been a problem? Now here there comes a aspect of support and motivation. So again, this will be into three parts. First at home, lack of support at home, lack of support at school or work, and 20th one is the lack of support at community. 21st, in the past 12 months, how often did you experience the prejudice or the discrimination? Whether there was any kind of discrimination because of the injury, right? 22, in the past 12 months, how often has the lack of program and services in the community been a problem, right? If whether any of the services were not available, if a person wanted to avail any kind of specific service, whether it could be related to any of the barriers, then the person has to tick. 23rd, how often did the policies and rules of businesses and organizations make problem for you? This is again an area which was untouched in the three outcome measures, that any of the policy or specific rules of any of the organization maybe in which a person is working, that might have raised a problem. 24th, how often did education and employment program and policies make it difficult to do what you want or need to do? Again, educational or employment programs area was also untouched. If they might have any kind of policy, then whether that has created a little problem or big problem. 25th, in the past 12 months, how often did government programs and policies make it difficult to do what you want or need to do? Right? So these are the all the questions that are included in the long form. Now, in the short form, there are only few questions that have been focused upon. The first one is related to transportation. Second one is related to, I'm so sorry. Second one is related to the environment, related to temperature and climate. Third one is related to again environment, but that is related to lighting, noise, crowds, etc. Fourth one is related to the information aspect, which we saw that a person needs any kind of information and then they are not getting it. Fifth is related to the healthcare and medical services, which a person wants to avail, but again, if they are not available. Sixth, regarding somebody's help at home or even regarding somebody's help at the school or work area. Eighth one, regarding the attitude of other people towards the person at home or at school or work. 10th one, regarding the discrimination, which we discussed in the long form. 11th, regarding the policies and rules of business and organizations. And the 12th one, that is the government programs and policies, right? So this is a short form that includes many of the important aspects of the community integration, or if I say many of the aspects of the environmental uh, integration for a person with SCI. So then a researcher or even a clinician or a academician has to decide that which outcome measure needs to be used. So till now, 4 outcome measures have been discussed. Let me jump to the next one. Scheme, as I said, that is spinal cord independence measure. In this outcome measure, one thing that is different from other outcome measures is that there are here sections given that you are supposed to take the follow up of your patient, right? In one questionnaire only, they have given these columns here, tiny boxes here, not columns, boxes. And here you have 1, 2, 3, 4, 5, 6. So at least you can take 6 examinations in one form. You are writing the patient's name, the ID if they have, if it is a hospital setup, and whatever a person's name is, and then you take the 6 assessments, 6 follow-up sessions, I mean. The first question, first aspect is self care, in which it is feeding. Now, feeding will be including all the aspect: cutting, opening the container, pouring, bringing food to the mouth, and holding cup with fluid. All these aspects will be included. Here, if you score 0, if a person needs parenteral gastrostomy or fully assisted oral feeding. 1, if the person needs partial assistance for eating or drinking or by wearing the adaptive devices. Third, a person is eating independently, but any of the adaptive devices or assistances are being used. Third, eats and drinks independently, but it does not requires any of the adaptive device. Second, coming to bathing, now this is divided into two: upper body and lower body. You can see the differences in all the outcome measures which we have discussed till now. This is specifically focusing on personal care activities in detail. I am not telling that those outcome measures did not discuss. In the first one only we had seen, but that was not that much in detail. Here you see the bathing is divided into two sections also, that is upper body and lower body. And even for the therapists, clarified documentation, activity has been mentioned clearly in the bracket. So bathing includes soaping, washing, drying body and head, and manipulating the water tap also. Okay. So the whole sequence is given that all these number of activities are coming under bathing. 0 requires total assistance. 1 requires partial assistance. 3 washes independently with adaptive or in a specific setting. Okay. Now people who suffer from SCI, they might have made any kind of modifications at their home, at their in their bathrooms and in their bedrooms. So if any kind of specific setting is there, then that is also mentioned here. Then uh, third one, the score 3, washes independently, does not requires adaptive devices or specific setting, right? Both the 0, 1, 2, 3 will be same for upper body and lower body, but the scoring will be different for upper and lower body. Why so? Because spinal cord injury, level of spinal cord injury will state the affection. Okay. It is not necessary that all the patients with all the people with SCI will have involvement of the whole body. That depends on the level of injury. Coming to dressing, again, it is divided into upper body and lower body. Now, what does that dressing section includes? It includes clothes, shoes, permanent orthoses if the person is using, dressing, wearing, and undressing. 0, the person requires total assistance. 1, partial assistance with clothes without buttons, zippers, or laces. Now, these are the additional uh, components that are given to the person once they suffer from SCI. Okay. 2, independent with Quobazal requires adaptive devices and or specific settings. Third, again, independent but does not requires any of those specific settings or adaptive devices, but they need the specific assistance only for bezel, right? The fourth one, dresses any cloth independently and it is not requiring any kind of adaptive device or specific setting. So if a person is suffering from paraplegia, that means that if they have affection only in their lower limbs, right? So they might score 4 in A section of dressing, but then in B section it might be different. Fourth, grooming. Again, grooming activities are mentioned: washing hands and face, brushing teeth, combing hair, shaving, applying makeup. 0 requires total assistance, 1 requires partial assistance, 2 grooms independently with adaptive devices, and 3 grooms independently without adaptive devices. So this was one section. Now another section is respiration and sphincter management. Okay, so the respiration includes the 0 if a person requires tracheal tube and permanent or intermittent assisted ventilation. 2, breathes independently with TT, requires oxygen, much assistance in coughing or TT management. Fourth, breathes as independently with TT, that is tracheal tube, requires little assistance in coughing or tracheal tube management. 6, breathes independently without tracheal tube, requires oxygen, much assistance in coughing, or even a mask is being given. 8, breathes independently without tracheal tube, requires little assistance or stimulation for coughing. And the 10th one, breathes independently without assistance or device. So here now the breathing respiration aspect is also included. Sphincter management again divided into 2, bladder and bowel. 0, that is indwelling catheter. 3, residual urine volume is more than 100 cc. No regular catheterization or assisted intermittent catheterization is being required. 6, RUV, that is residual urine volume is less than 100 cc, or intermittent self catheterization, and it also needs a assistance for drainage. Ninth, intermittent self catheterization is used. It is using external drainage instrument, and it is the person is not requiring assistance for applying. 11, intermittent self catheterization, continent between catheterizations and does not uses the external drainage instrument. 13, residual urine volume is less than 100 cc, needs only external urine drainage and no assistance is required. And 15th, again residual urine volume is less than 100 cc, continent, patient is not using any of the drainage instruments. 7th, it is sphincter management, but bowel. So irregular timing or very low frequency. The person says that less than once in 3 days a bowel movement is occurring. 5th, the timing is regular, but a person needs assistance. There will be very rare accidents that less than twice a month might be an episode wherein a bowel movement has passed. Okay. 8, regular bowel movements without assistance, and there will be again rare accidents. Here again less than twice a month. 10th, regular bowel movements without assistance, and there are no accidents. Coming to 8th one, use of toilet. Here again the activities are mentioned: perineal hygiene, adjustment of clothes before and after, and use of napkins or diapers. So 0 is requires total assistance, 1 requires partial assistance but does not clean self, 2 requires partial assistance, cleans self independently, 4, uses toilet independently in all the tasks but needs adaptive devices or special setting. As I mentioned earlier, also that a person with SCI might have some kind of modifications at their in their bathrooms also. So there could be any of the special setting. Fifth, uses toilet independently and does not requires adaptive device or special setting. So that is related to bowel bladder management, toileting activities, and respiration. Now, mobility aspect. Now here the mobility is also again divided into sections. The first one is mobility in bed and action to prevent the pressure source, right? We already know that if a person is bed bound, we need to prevent the pressure source by proper positioning and by proper mobility. Here, zero score is a person is needing assistance in all the activities, whether it is turning upper body, lower body, sitting up, doing push up in wheelchair, right? So you score them 0. 2 performs one of the activities that are mentioned above without assistance. 4 performs 2 or 3 of the activities without assistance. 6 performs all the bed mobility and pressure release activities independently. If the person is also on wheelchair, then also a person needs to do the push-ups on wheelchair. Continuously sitting on a wheelchair for 3 to 4 hours again is a invitation to pressure source. So for its prevention, a mobility is required. 10th, transfer activities specifically from bed to wheelchair. Here, locking of the wheelchair, lifting footrest and removing adjusting armrest and then transferring and then again lifting feet. So the whole sequence. Okay. If a person is requiring assistance, then 0. Person requires partial assistance or supervision, then 1. And if it is independent, then 2. 11. Transfer from wheelchair, toilet, and then tub. If a person is using toilet wheelchair, then transfer to and from. If a person is using regular wheelchair, then locking, again same sequence, locking the wheelchair, lifting footrest, removing and adjusting arm rest, transferring and lifting the feet. The answer scoring will be same as 10th, that requires total assistance, needs partial assistance and or supervision or adaptive devices, and independent. The another component, mobility, but here it is related to mobility that is indoor and outdoors and on even surfaces. So mobility indoors, you score 0 if total assistance is required. Move needs electric wheelchair or partial assistance to operate manual wheelchair, that it falls under 1. 2, moves independently in manual wheelchair. 3, requires supervision while walking with or without devices. 4, walks with a walking frame or crutches. 5th, 5, score 5, walks with crutches or 2 canes. 6, walks with 1 cane. 7, needs leg orthosis only. And 8, walks without walking aids. So again, mobility indoors is having the section. Mobility for moderate distances, that is from 10 to 100 meters, the scoring will be same as the mobility indoors, all the components from 0 to 8, but here only the question will differ. The first one is mobility indoors in their home. The second one is mobility for moderate distances, 10 to 100 meters. Now the mobility outdoors, if the distance is more than 100 meters, again the scoring will be same, that is from 0 to 8. 15th, that is stair management, whether the person is able to ascend or descend stairs. If it is if he or she is unable, then 0. Ascends and descends at least 3 steps with support or supervision of another person, then you score 1. At least 3 steps with support of handrail or crutch or cane, then you score 2. 3 steps without any support or supervision, then you score 3. Coming to 16, again transfer, but now the transfer is from wheelchair to car. Okay, so for that transfer, the person requires total assistance, then 0. Needs partial assistance and supervision or adaptive devices, then 1. And does not requires any kind of assistance, transferring independently, then it is 2. 17th, transfers ground and on wheelchair. From the ground to the wheelchair requires assistance, and the 1 is transfers independently with or without adaptive device. Here only the 2 scores are given, because from the ground to wheelchair there is no option. Either you take the assistance or you transfer independently, right? So the total scheme score which you are going to get, that is from 0 to 100, and each section is also having a subtotal, right? So even if you want to see that which area is having improvement, then that can also be done by using this outcome measure. Ma'am, should I continue? Okay. Now, the another scale which we are going to see, that is participation assessment with recombined tools. Here, first questions are about the basic activities. Now here, a therapist is going to ask the questions. The first one is, in a typical week, how many hours do you spend working for money, whether in a job or self-employed? Here, the categorization is on the basis of time. If the answer is none to any of the following questions, you score 0. If it is 1 to 4 hours, you score 1. 5 to 9 hours, you score 2. 10 to 19 hours, you score 3. 20 to 34 hours, you score 4. 35 or more hours, you score 5. And if a person says that I don't know, or I'm not sure, or I don't want to answer, then you can give the score of 9. Okay, so all these scores will be, all these categories and scoring pattern will be used for the following questions. The first one is related to how many hours do you spend working for money, whether in job or self-employed. So somebody might not be employed, so they might fall under the category last one. Second, in a typical week, how many hours do you spend in school working towards a degree or in an accredited technical training program, including hours in class and study? Third, in a typical week, how many hours do you spend in active homemaking, including cleaning, cooking, and raising children? So these are the typical activities which a person might do, and then you will score them. Fourth one, that is related to other activities regarding the socialization with friends or in person or by phone. The fourth question, how many times do you socialize? Here the category is 1 to 4 times, the score is 1. 5 to 9 times, the score is 2. 10 to 19 times, the score is 3. 20 to 34 times, the score is 4. And the person, if says that 35 or more times, then it is 5. Fifth one, in a typical week, how many times do you socialize with family and friends or relatives? In a typical week, how many times do you give emotional support to other people? Right? That is, listen to their problems, not only just discussing about your own problems. How many times do you use internet for communication, for email, for instant messaging? How many times do you get out of your house and go somewhere? It could be anywhere, any of the places. Now we have questions related to month. That in a month, how many times the activities will be, how many days will be done, or how many times you are going to do that activity. So in a typical month, you have again category, how many times do you eat in a restaurant? So as the question is times, you are going to ask 1 to 4 times, 5 to 9 times, 10 to 19 times, 20 to 34 times, 35 or more times. And even the person says don't know, not sure, or the answer, they may answer that I don't want to answer. 10th one, how many times do you go shopping? That will include everything, grocery shopping, household necessities, or just for fun. Sports activities, how many times do you engage in sports or exercise outside your home? Activities like running, bowling, going to the gym, swimming, walking, etc. Right? Now, again, these are the questions that are related to the month. The questions will be according to the month. In a typical month, how many times do you go to the movies? 1, 2, 3, 4, 5, or again, the same thing that I don't want to answer. And likewise, you will score. In the whole questionnaire, whenever the person is telling that they don't know, they are not sure, or they don't want to answer, then you are going to give them a score of 9. In a typical month, how many times do you attend sports events in person or as a spectator? In a typical month, how many times do you attend religious or spiritual services? This question was not yet asked in the outcome measures. Now, if a person, you need to ask them that whether the person is living with their spouse or not. If the question is, if the answer is yes, then you go move to 16th question, right? You no. If the answer is yes, you are going to skip to part question 17, and if the question is 17, if the answer is no, then you are going to ask the 16. When item 15 is yes, assign score of 5 to both question 15 and 16 for a total point of 10 points. Okay. So if a person says that yes, I am living with my spouse, then you are going to ask them whether you are involved in any of the intimate relationships, whether it is sexual relationship or romantic relationship. This area of rehabilitation needs to be focused because it is again a part which is not emphasized, and this barrier is also faced by the people. 17th, if the person says that no, I do not have a spouse, I do not live with any, if the spouse, or if I'm not married, then you need to ask that whether they have a close friend to whom you confide. Okay, if there is anybody whom you like. Now here you are going to calculate all the scores, right? Whatever scores you have got, whether it is related to productivity, social relations, right? And then in the domain scores, if the person has anywhere answered you that I don't know, I don't want to answer, so that will be included in missing items, and these will not be included in your domain scores. That is again a very important thing. As soon as you get the score of productivity, social relation, and out and about, whatever the things we have discussed, you are supposed to sum them up, and then you are supposed to divide them by 3, right? And once you divide them by 3, you are going to get the average total score of the part O. Now, the last outcome measure which we are going to discuss, that is World Health Organization Disability Assessment Schedule. Here, the section includes answering the question in 5 forms, that is none, mild, moderate, severe, and extreme or cannot do. Here you will be seeing that it is again divided into sections. You are going to ask them the question that in the past 30 days, how much difficulty did you have in? Right? You are supposed to take the data of the past 30 days. So the first one is concentrating on doing something for 10 minutes. This first section is regarding the understanding and communication. So you are asking concentrating on doing something for 10 minutes. So patient might answer any of them. Second is remembering to do important things. Third, analyzing and finding solutions to problems in day-to-day life. Learning a new task, for example, learning how to get to a new place. Generally understanding what people say. And the sixth one is starting and maintaining a conversation, right? So these are the six questions that will be asked under the domain of understanding and communicating. Second one, getting around, that is related to the mobility aspect. So standing for long periods such as 30 minutes, standing up from sitting down, moving around inside your home, getting out of your home, walking a long distance such as a kilometer. So this is including the mobility component of the person. Now coming to the section of self-care. So again, in the past 30 days, how much difficulty a person has faced in washing your whole body, getting dressed, eating, staying by yourself for a few days. You see the difference in this, and we have also seen one outcome measure that was titled as SKIM. So in SKIM, it was clearly mentioned. The question was washing. When the question came bathing, it was divided into two. That was upper body and lower body. Getting along with people, dealing with people you do not know, maintaining a friendship, getting along with people who are close to you, making new friends, and sexual activities. Right. So here, as the outcome measure is including almost all the components, so the questions are asked in this way. Life activities, considering taking care of your household responsibilities, doing most important household task well, getting all household work done that you needed to do, getting your household work done as quickly as needed, your day to day work or school, doing your most important work or school task well, getting all the work done that you need to do, or getting your work done as quickly as needed, right? So again, this is focusing on the work or school component of the community reintegration. Now the section comes that is participation in society. So again, in the past 30 days, how much of a problem did you have in joining in community activities? So community activities could be anything, any of the festivals, any of the religious gathering or other activities. Then how much of a problem did you have because of barriers or hindrances in the world around you? These barriers or hindrances could be anything. How much of a problem did you have living with dignity because of the attitude and action of others? Here, the response or the behavior of surrounding people or the community people comes into picture. Okay. How much time did you find on your health condition or its consequences? How much have you been emotionally affected by your health condition? This is a aspect of mental health here, which is focused, right? How much has your health been a drain on the financial resources of you or your family? The financial aspect of community reintegration, because here the direct question is asked that whether the health has been a drain on financial resources, because a person who suffers from SCI, they have much of the medical treatment and rehabilitation protocols which they need to follow, which requires much amount of finance. How much of a problem did your family have because of your health problems? Some might answer you none, some might say severe also. How much of a problem did you have in doing things by yourself for relaxation or pleasure? Overall, in the past 30 days, how many days were these difficulties present? Whatever the difficulties were asked, you need to ask them that how many days were the problems present in the past 30 days. For how many days were you totally unable to carry out your usual activities or work because of the health condition? And the last one, in the past 30 days, not counting the days that you were able, but for how many days did you cut back or reduce your usual activities or work because of any health condition? Consider a person is already suffering from SCI, and then they have also faced a pressure source. So that is again uh, giving a cutback or reducing their usual activities because of the health condition, right? So this is a questionnaire that is WHO disability assessment schedule. So depending on your goal, depending on patient's goal, depending on what documentation you require, you can use any of the outcome measures which I have discussed. All these outcome measures are freely available on the internet, and if it is not available, if you are not able to find, you can contact me. I'll definitely give you the outcome measures. I'll just share my, just a second. So if you want to connect, you can connect on my email ID, that is dr.pallavi.sv@gmail.com. And you can also drop me a message on Instagram, that is Pallavi Rajesh Kumar, and I'll definitely send you the outcome measures. Thank you very much.
Well, Dr. Pali, it was really an incredible lecture. The topic in itself, that is from rehabilitation to real life, the outcome measures for assessing community reintegration in individuals with spinal cord injury. Well, I being a neuro faculty, it is a very interesting topic for me, the spinal cord injury and the community aspects of this. Uh, through your lecture has shown a very good insight, and it was really a very insightful and informative lecture. Thank you so much for being with us. Thank you, Dr. Pali.